Hey guys, my name is Jesse, and I'm on the negative side of physician-assisted suicide and believe that it should not be legal. In his significance claim, he makes a claim saying that guidelines are there to make us the only people who are terminally ill or follow the guidelines to be able to do it will go through. But I believe that it's a very slippery slope and that it can turn into something much worse. And Dr. John Finnis, a legal philosopher at Oxford University, says that if autonomy is the principle or the main concern, why is the lawful killing restricted to terminal illness and unbearable pain? If suffering is the principal concern, why is the killing restricted to terminal illness? So it's like, if someone is just going through pain, I mean, if people if someone is going through some sort of pain, like that's not terminal illness or unbearable pain, like later down the road, they're going to want to be able to do this too. And it just leads to going further and further down the road. Also, Dr. Finnis says, in Switzerland, suicide clinics legally offer death to disabled and terminally ill alike. A thriving micro-industry in suicide has developed in recent years known as suicide tourism. There have even joint suicide by spouses who don't want to live without each other. This can be done because of the lenient laws for assisted suicides in Switzerland, which shows that just how lenient these laws can get over time and will make it more and more acceptable for more and more people to do this. In his inherency claim, he claims that it's the state's rights to make these decisions, but I believe that making this legal would hurt families and culture. Dr. Barnes Mary Warnock, a leading ethicist in the UK, says that these demented people feel like they are hurting everybody around them by sticking around and will almost develop a feeling that they have a duty to die. So these people are actually feel like since they are sticking around that they are hurting their family, and that since it's now an option for them, they will be able to do this so they can stop burdening their family. And this is something that could destroy families and hurt several people. And then Dr. Ryan Anderson, a senior researcher in American Principles and Public Policy, says in his article, physician-assisted suicide would harm our entire culture, especially our family and intergenerational obligations. The temptation to view elderly or disabled family members as burdens will increase, as will the temptation for those family members to view themselves as burdens, which just can almost be led back to the slippery slope of how it can just continue to get worse and it'll almost become a normalized act. Dr. Barnes Mary Warnock later in an article says, if you're demented, you'll feel as if you're wasting people's lives, your family's lives, and you're wasting the resources of the National Health Service, which can drive them towards this outcome and actually make them want to do this so that way they feel like they're not wasting resources anymore. And Dr. Paul McHugh, a psychiatrist and researcher at Johns Hopkins University, says in his article, once doctors agree to assist people's suicide, ultimately they find it difficult to reject anyone who seeks their services. Thinking of patients, the killing of a patient by doctors spreads to and encompasses many treatable but mentally troubled individuals who are not in a right mind space to be making these decisions. So a lot of people who are going through this are just going through a lot of things like depression and mental illnesses and could be making the wrong decision, which could lead them to end up taking their own life because they feel like they're burdening their families. And his solvency claim was that it was denied back in 1997, and that technically we don't know how it would go. But going back to the whole Switzerland problem, they've had this for some time now. And they are already going through issues, and it's already gotten so lenient that people are starting to do this just so they don't have to die alone, and it's just going to get more and more lenient as it goes. And Dr. John Finnis, a legal philosopher at Oxford University, studies have found that in Belgian doctors now openly couple voluntary euthanasia with organ harvesting, which this leads to a final point that physician-assisted suicide can actually lead to corruption in the medical field and drive doctors to want to kick people out of their hospitals and turn it into more of a money-making thing like Switzerland is doing right now with their micro-industry business. And Dr. Paul McHugh, in his article, says, when a right to die becomes settled law, soon the right translates into a duty. That was the message sent by Oregon, which legalized suicide, physician-assisted suicide in 1994. When the state-sponsored health plan in 2008 denied recommended but costly cancer treatments and offered a less expensive alternative, which would be assisted suicide. So there are many people who are lower income and can't afford treatments for their diseases like cancer and other things. So they're actually going to have to come to that conclusion that maybe they should just do a physician-assisted suicide because it's going to be cheaper for them. Dr. Paul McHugh later goes to say that limits on hospital reimbursement based on length of stay and diagnostic group, falling hospital revenues, and social need to allocate health dollars may all influence physicians' decisions to make that decision at the bedside. So it's almost like after a while it's going to become the physician's responsibility to make these decisions to help make money for the hospitals and to turn it more into a business than an act of kindness for these people. And then finally, Dr. McHugh says that under any new system of healthcare delivery as at present, it will be far less costly to give a lethal injection than to care for a patient throughout the dying process. So this just shows that it could even corrupt doctors, not only the people running the hospitals, but these doctors who want to get these people out of their hospitals, and it'll end up being their decision. That is it. Thank you.
You guys must be new.